Children with disabilities is a wide overarching population that houses a lot of different disabilities. Generally, children with disabilities have long term conditions that are present at birth or are gained later in life, and these disabilities tend to affect their day to day activities. Disabilities can be divided into categories: physical, mental, intellectual, and sensory. For the basis of this project, as a wide overview, we will be talking about children with all disabilities. Historically speaking, children with disabilities have faced heavy discrimination and were often hidden out of the public eye. Many U.S. cities in the 19th and 20th centuries had ugly laws that mandated that persons who remain disfigured and are otherwise obviously disabled were not allowed in public view in community spaces such as sidewalks, parks, and public buildings. This also included libraries in some places. It wasn't until the 1960s that laws began being put in place for people with disabilities. In 1975, the Education for All Handicapped Children Act required all public schools that received federal funding to provide equal access to education for all children with disabilities. They also required that each child were to be given an individual education plan with input for parents, and that they were to be educated in a setting as close as possible to a regular schoolroom. In 1979, the Office of Special Education Programs was created. It was responsible for providing financial support to states and local school districts for services to children and young people with disabilities from birth through age 21. And in 1990, the Americans with Disability Act was created with the intent to prohibit discrimination for people with all types of disabilities in all areas of public life. The history of children with disabilities is steeped in maltreatment and a lot of discrimination. There were a total of 8 possible traumas that, through research, I found that children with disabilities may endure. The first one is neglect. While it is one of the most common forms of child maltreatment, it is notoriously difficult to measure because it is perceived as subjective. In children with disabilities, it was found that they experience higher rates of neglect than children without. Emotional abuse, when experienced by children with disabilities, is limited as far as our knowledge of it, because emotional abuse is often excluded from maltreatment studies, so it's hard to measure. Hendricks and colleagues in 2014 did find that children with sensory and motor disabilities were generally more likely to experience psychological aggression from primary caregivers than children with other disabilities. Physical violence can be a trauma that is very prevalent. It does get conflated with behaviors such as spanking, hitting, shaking, hair pulling, and battering. So, some of the disciplinary violence that goes into physical violence could be conceived different based on culture. It also can be physical violence from peers. Um, One study did show that children with ADHD are significantly more likely to experience peer assault and abuse. When it comes to sexual violence, um, studies show that children with disabilities are 2 to 3 times more likely to experience this than children without disabilities. Um, and this was found to be at a higher risk with children with cognitive learning and our other developmental disabilities. When it comes to discrimination, children with disabilities are often common experiences for children with disabilities across cultures, and this would include teasing, bullying, and exclusion. The next possible trauma is institutional violence. Um, One of the frequently implicated settings are schools. Um, Studies did find that when incidents were reported to schools, 24% of schools did nothing about the incidents. And Robinson in 2015 argued that institutional violence occurred more frequently frequently in agencies where there is a significant imbalance of power between service providers and children with disabilities. This could also happen in facilities like social service agencies and residential care homes. Structural violence when it comes to children with disabilities is more structural and social inequalities. So think more that children with disabilities are generally um, more likely to live in poorer neighborhoods with less access to transportation and services. So they may not be able to get support services or be able to afford them. The last possible trauma that my research discovered was war or disaster. A family with a child that has a disability or an individual with a disability may struggle with inaccessible evacuation routes and experience communication barriers that inhibit ability to be able to request support. They also may be abandoned by their communities due to the challenges associated with fleeing from said danger. When looking at the long term effect of trauma of children with disabilities, the research is very scarce. However, in the article, A Call to Action Extending the Research on Trauma Assessment and Treatment for Children with Intellectual Disabilities and Extensive Support Needs, they found that these adults were at a greater risk of poor physical and mental health, chronic disease, as well as having a negative impact on their health due to being unable to access quality healthcare services. The study also noted high levels of fatigue and noticed that men were presenting with high levels of pain and poor overall physical functioning. One problem that they did find in this study was that it was all self-reporting, and so the data could be skewed based off of different populations or genders being more comfortable with sharing. In order to better serve children with disabilities and their families, libraries can start by highlighting and providing access to resources and services for children with disabilities and developmental delays. Partner with early intervention services and expand outreach to rural areas and or families with mobility concerns. Creation of appropriate spaces for children of disabilities where they can be loud and expressive, and also fix our behavioral expectations of children in our spaces. How libraries can serve children with disabilities. Two ideas that I had was to first start by creating a program timeline that would be published on the website. It would be available so that families can look ahead to see what a program would entail, so that children can be prepared for when we go maybe from story time to a craft to a different area in the library, just so parents can be prepared and their kiddos as well. The second idea that I had came from looking at the research and seeing how parents of children with disabilities really wanted to be connected with resources in their areas. And I thought it would be a really good idea to invite medical professionals that specialize in certain disabilities and have them host like a community meeting with parents, and that way they could ask questions and we can get feedback from families on what they need from the library. When it comes to practitioners and how they can better serve children with disabilities, a lot of what I was picking up from the research that I did was that increasing routine screenings for abuse in patients with disabilities would be a good thing. Also, changing the way that practitioners thought of child development and normal development, and taking the normal part of it out, and not comparing children with disabilities to other children. And changing that self-perception would help a lot in making sure that they are getting the quality care that they deserve. Lastly, is using treatments that target physical and mental symptoms of individuals who have faced childhood trauma. So, bringing informed trauma care approach to how practitioners serve children with disabilities. When it comes to future research in trauma informed care for children with disabilities, the first one that I thought they could look further into is the impact of social and cultural diversity on violence toward children with disabilities. The second one was disability education and activism occurring within the social work profession. The third one is the impact of different types of trauma on long term physical health outcomes. And the fourth one is the integration of trauma informed care for different types of trauma in medical and rehabilitation settings. I chose these for places that could use further research because it was a commonality of what the researchers wanted when I was looking into various articles. And these were all things that professionals in social work and in library services, particularly medical professionals, were very interested and needed the information that was lacking. Thank you so much for listening to my presentation, and I hope you have a full rest of your week.